Hello, welcome to The Other Side, Mississippi Today's political podcast. I'm Kate Royals. I'm the managing editor here at Mississippi Today, and I'm really excited to be joined by Alan Siegler, our mental health reporter. Alan has reported on opioid settlement funds in West Virginia and Georgia, and has spent the past 3 or so months on a big project here in Mississippi that we'll get into here in a minute. But I want to introduce our other guest, Tricia Christensen. She's got a master's of public policy, and she's a nationally recognized leader in harm reduction, overdose prevention, drug policy, and opioid settlement spending specifically. She is based in Tennessee and has a lot of really good insight into how Mississippi, along with 12 other states in our region, have been managing their opioid settlement dollars. Welcome, Tricia.
Thank you so much for having me.
So to kick us off, I wanted to talk a little bit about, Alan, your work over the last 3 months, which has been arduous. And you have put in public records requests with 147 Mississippi localities receiving opioid settlement money. And basically, this is the first time that anyone in Mississippi really gets a comprehensive picture, or much of a picture at all, about how this money, this specific pot of money, is being managed across the state. And some high-level findings that you found and you go into in your series that publishes today is that of the around $6.5 million spent so far by cities and counties, only about $945,000 has been spent on expenses related to addiction. So we are 3 years into receiving this money from companies that contributed to the opioid crisis. And compared to all of the bordering states, Alabama, Louisiana, Tennessee, Arkansas, Mississippi has by far spent the least amount of its money on addiction specifically. Our bordering states, Alabama, Louisiana, Tennessee, and Arkansas, have all at least spent $4 million. So, Alan, I want you to just talk about, your findings and what you were thinking as you were reviewing all of this information and then putting it together in a comprehensive way. Tell us what that was like.
Yeah, thank you so much for that introduction. So when I just started at Mississippi Today about 4 or 5 months ago, and one of the things that you and I both wanted to really dig into was looking at the opioid settlements. That was, I contacted Tricia pretty early on. Tricia and I had worked together when I was reporting on this in West Virginia, and she connected me with some people who she thought might have some insight into how Mississippi is spending its opioid settlement money. People who are involved in the world of addressing addiction. People like James Moore, who I met pretty early on within the first month of being here at Mississippi Today. I remember calling him and asking him what the status of Mississippi's opioid settlement distribution was, and he didn't have any idea. He had heard something related to, within the last year, if I remember correctly, that his local governments were getting some money, but he just hadn't heard anything about how much it was getting, when it would be distributed, on what it would be distributed. So that was kind of shocking to me. I think just coming from other states that had very publicly made awards of this money, regardless of whether I or others thought that it was the best use of this money, there was actually information about where it was coming. So when he said this person who, had a little bit about James's background, he lives in Hattiesburg. Unfortunately, when he was in the 2010s, he tragically lost his son to addiction, to an overdose, I believe. And since then has really worked to create some of the addiction response resources that he thinks Mississippi really needs, especially in the Pine Belt region. So when someone that involved didn't know what was happening, I wanted to really find out what was going on. So we filed some public records requests with the local governments in the Hattiesburg area. We did Forest County, Lamar County, and Hattiesburg. And from those public records, we got the information back pretty quickly, and we found out that those local governments combined at that point in time had received around, I believe, $750,000. And they'd been accumulating that over 3 years, which, I mean, like, James Moore says that he watches the news in that region every single night, and he had never heard anything about that over the 3 years, which was interesting because in West Virginia, this was a big thing when these local governments were presented this money. Someone came from the accounting firm to give the check, and it was just this very public thing. So the fact that I wasn't surprised that Mississippi local governments had been receiving the money this long, but the fact that they had only just publicized that they were receiving this money, and only when we legally required the information, asking for the information, that was pretty shocking to me. So we wrote a story about that. We found that some of the money was being spent of those 3 local governments, was being spent for a local drug treatment court. Another chunk of that money was being spent for the sheriff's department to purchase things like radon spectrometer, I believe, which I had to look up. And there were drug testing devices that my understanding is a lot more expensive than would necessarily be needed to comprehensively understand what substances are present in the Hattiesburg area. There was an X-ray machine for scanning drugs in walls. We wrote about it, and that kind of gave me a taste that, okay, this information is accessible. And while I was really happy that we were able to get that information, I did know that there was, a list of over 100 governments that we really knew nothing about up to that point. So from there, we started. I remember going to you and saying, let's just kind of request this same information from the 10 governments getting the most amount of money. And we started doing that. And then I went back to you and said, let's keep going a little bit. Let's keep going. And eventually we got down by the middle of June. We had requested records from all but one that I forgot. And we got that one later. But we had requested the other 145 or 144 local governments that had received money. And we got this picture. So we learned that, the local governments told us, the cities, counties, towns told us that they had received about $15.5 million, like you talked about, and we could only account for about $945,000 that went directly to address addiction, as was defined in one of the opioid settlements.
So, and I should have led with this earlier, but to set the stage a little bit, part of the reason that we're having to do this is because in the agreement that the Attorney General, Lynn Fitch, developed that basically states the rules and regs for the spending of this money, there are no public reporting requirements, unlike other states.
That's right. There are, at least for the local dollars. So every state in the country, for background, is receiving some amount of opioid settlement money, and they get to choose. Once they receive that money, once they've agreed to receive that money, they get to make their own decisions about how that money goes out, how it's actually distributed, in theory, to abate the overdose crisis. Mississippi designed an agreement in, I believe, the fall of 2021 was when it was published, that sent 15% of the total amount of money that Mississippi received. That number could change, but right now it's expected at $421 million.
Over the course of about 20 years, right?
Over the course of through 2040, yes.
Got it.
And Mississippi decided that 15% of that money would be sent directly to the local governments, and they could spend it on whatever they wanted, and they were not required to report any of this. And I want to bring in Trisha here. Trisha has been tracking this spending throughout first Appalachia, now throughout the country for a really long time. Trisha and I first met when I was reporting in West Virginia, and she was running the Appalachian Opioid Remediation Project. Trisha, do you mind speaking a little bit about what you saw from the 13 states you were monitoring during that period and how Mississippi fit into those states?
Absolutely. Yeah, back in 2022, I was working with an organization that was focused on the Appalachian region. So we were curious how each of the states was spending their settlement funds. And the first thing that we did was ask some of our partners on the ground, kind of like you went to James Moore. I think I called James Moore back in 2022. In every state, it was crazy to me to hear that nobody really knew what was going on. They hadn't been brought into any planning conversations. And these were folks that work on the ground doing opioid remediation, which again is what these dollars are for, is opioid remediation. They were on the ground, they work on shoestring budgets. They're the ones who are already making an impact, and with some extra funding could probably make an even bigger impact. And so we started looking into it on their behalf. And the first thing we noticed is that even among the sample of just those 13 states, every state had a different plan, right? A different way of managing their funds. So a certain percentage to different entities. But what I noticed is that every state, and I think this is true across the country, every state has at least some percentage going directly to local governments. And to be clear for your listeners, like directly means like from the settlement administrators to the local governments. That's not going through the AG's office. There's nobody at the state level who's like keeping an eye on that necessarily. And this is still different in different states. In North Carolina, 85% of the funds are going directly to counties. Mississippi, it's 15%. So of course, things are going to look a little different when it's different sizes of the pie. But as part of our tracking, we started digging through county council meeting minutes to find any mention of opioid settlements. And we were compiling what we were finding into a public database to share with our partners on the ground. And we noticed that in some states, not only is it easier to find because they have, a lot of their county councils have those minutes posted online, but we were finding it, right? We were doing a control F search through minutes and finding mentions of opioid settlements. Mississippi was particularly interesting to me because, number one, like the original plan, which I know has changed, but the original plan was to send 70% of the money to a university for some like fancy new program to create. So I was like, okay, like that's cool. But then when I dug in, I found literally nothing about it. I couldn't find any mention of this. And then when I was looking into at the county level, I was finding nothing. If I remember correctly, a lot of counties don't have their minutes published publicly. And if they do, I just was finding no mention of opioid settlements. And so I kind of gave up on Mississippi. I was like, well, I'm going to focus on my other 12 states. And I checked in here and there. I was asking folks who lived in Mississippi to look into it. They couldn't find out anything. I was working with a national reporter at the time who's doing some stories, across the country. She was asking around and couldn't find anything. So I was thrilled when Alan reached out this year, 3 years later, to say that he's like, okay, I'm a local reporter now and I'm planning on digging in. I was like, this is what we need. We need somebody who is in Mississippi, who can do the hard work, ask the hard questions, and find something out about how these funds are being spent.
Oh, thank you. That means a lot. When I first shared some of this information and we were talking about Mississippi early on, you called this Mississippi spending up to this point a black box. Can you tell me about what some of the consequences of keeping this information so out of the public eye are for public health?
Yes. Black box is the perfect term for it. Again, a lot of states have moved slowly with how they are allocating their funds. But with Mississippi, it wasn't just that they were moving slowly, it was that there was no information. So as Alan knows, in West Virginia, they were moving very slowly, but there was still some public information, and there were local reporters who were talking about it and were, pushing people, being what's going on. And so they finally started up their foundation to oversee the funds, blah, blah, blah. In Mississippi, it's like there just was no information. And so people like James Moore, who is just like a local guy, a father who's, grieving his son, passes out in a naloxone in his community. He's well connected. He's not even an organization, but he's still a great example of somebody who he knows where that money could go. He knows who could benefit the most, who could do the most impactful work that would be in line with the opioid remediation requirements of this funding. And he had no idea what was going on. And so that means that the money is either not being spent, which if you're in the process of putting together a strategic plan and that's why you're holding your money, okay, I get it. Or they just weren't doing anything with it, which is kind of what it seemed like was happening in Mississippi, right? It seemed like they weren't thinking about it. They were just letting the money sit on a shelf when there are people dying every day from overdose and all the other, harms associated with drug use over time. So I am not an expert on the infrastructure of Mississippi, but my understanding is that there are plenty of things lacking, as there are in many states. And there are plenty of ways that I imagine the state could have quickly invested to start to build up that infrastructure, even if they were still trying to figure out their long-term plan.
And if not quickly invested, at least there would have been evidence of some semblance of conversations with community members, people in the know, to build the plan.
Exactly. And a lot of places have done that, right? They've like whether local governments that are receiving money or like a state entity who has a bigger pot of money, they've started out with some kind of like needs assessment or strategic plan if they didn't already have that information. And that is an acceptable use of opioid settlement spending. So they might be using their money to conduct that plan if they didn't already know where they should be investing it. And as part of that, the community input process, like really engaging community members, people with lived experience of drug use, people who have lost loved ones to overdose, your local health departments, all your local entities who know what the problems are, they know where the funding gaps exist already, and can give some really good insight into how that money should be invested.
I've got a question for both of y'all. So, Alan, I vividly remember you recounting, and this is in one of your stories, talking to a county administrator who was saying, he was earnestly saying, we want to do right by this money, but we just don't quite know what to do. And Tricia, you've mentioned how in some places there's not already an infrastructure, so it's sort of like starting from zero, and I imagine it could be overwhelming. So, Alan, can you talk a little bit about what that administrator said? And maybe, Tricia, you can weigh in about what other states are doing to provide guidance to localities that may not, they're not experts in this.
Yeah. So first, to Tricia's point that, we're worried that this money is just sitting on a shelf somewhere. I guess one of the things that this investigation found out is a lot of it is, over 50% of it, of the local dollars, so of the $15.5 million that the local governments have received so far is, but a lot of it isn't as well. It's being spent. We just didn't know about it. So we have the $945,000 that seems like that's 20 local governments of the 147 that are receiving money indicated to me some firm commitment to using these dollars on something that qualifies as addressing addiction. Then you have a lot of other governments not spending it up, and that is totaled at $5.4 million right now, and it's going to things. The most common thing, $4.3 million, which is general expenses. So, like, we're speaking in Jackson right now. Are we?
Yes,
technically?
we are.
Okay. We're close to the border of Rankin County, but we are sitting in Jackson right now. Jackson has received over $500,000 from the opioid settlement so far, and it's spent about $117,000, $118,000 for things like fiber optic cable installations, moving city offices, a new shelving system. There are law enforcement purchases that aren't specific to addressing addiction. There's EMS purchases that, again, aren't specific to addressing addiction, city vehicles, a small donation to a crisis pregnancy center in Vicksburg. So some of this money was being spent. It was just that we didn't really know about it. And you asked about the county administrator. That was in Copiah County. And I found Copiah interesting for a lot of reasons. I thought that the administrator there, from the sense I got, everything he's told me says that he really wants this money to go as far as it can in preventing more overdoses, in doing justice by the people who have died over the last 3 decades. But, county administrators, elected officials don't necessarily have the expertise to know exactly how to address this crisis. And that's no knock on them. That's just not some of the things that they've been preparing for, which is understandable. And I think that's why Tricia has flagged North Carolina for us a few times. Like, North Carolina created this really comprehensive list of frequently asked questions for its local governments to say, here's what you can do. Here's how you can really go into your community and figure out what the needs are. So the county administrator in Copiah County, I believe his name is David Engel, he told me that he wants the state to provide more guidance. But this goes back to Fitch's decision at the beginning of this process back in 2021. She communicated repeatedly that this money can be spent on anything that the local governments want. So you have this letter that, she sent really early on that says that while this money can't be spent on abatement, it can also be used for anything else. And there's you may get information, or you may get a request for documenting this as not actually addressing addiction, but you don't have to worry about it because we've taken care of that already. So that was in 2021. And then, our process for requesting this information was me just going to every local government and asking for all records, all receipts that show how much money you've received, and all documents that show how this money's being spent. And for the vast majority of that's what I received in some way, shape, or form. But I also got some other interesting stuff. And one of these things was this September letter that Fitch's office sent out to enough local governments. Sent it to me that it looks like it was sent out to every local government around September 2024. But it, again, reaffirms those same things. It's like, I'm just reading directly from the letter right now. As your community starts to accumulate funds, we wanted to also reiterate that your opioid settlement funds may be spent for abatement, but you are not required to spend them on abatement programs. The funds may be spent for whatever public purpose your governing body deems appropriate. So again, 2 years into this process, that was the same message, was just whatever you want. And David Ingle said that wasn't helpful for him. That's not guidance. That is for the local governments that really want to do something about this. That this is, this crisis, this public health catastrophe, this is not helpful for achieving that aim. And Tricia, you and I have talked a little bit about the incentives that the attorney generals can lay out for their local governments. Can you speak a little bit more to, some of the incentives? And you read Fitch's letter back in 2021 when it came out. Can you talk about what the incentives were there?
Yeah, I think that it was a really tragic decision on behalf of the settlement negotiators that they decided to send money directly to local governments, because our local government leaders, they might be experts in many things, but usually behavioral health is not one of their subject matters that they're an expert in. And depending on the size of the county, they may or may not frequently interact with their local behavioral health authority folks, right? Or local public health folks. And so a lot of government leaders across the country have said what the county administrator you're referring to has said, that we want to spend this money correctly, but I don't know what to do with this. What am I supposed to do? I always refer back. I remember listening in on a county council meeting up in Kentucky, or they call them fiscal courts in Kentucky. And the guy, he literally was saying, he's like, if we had the money, we would spend, we have this money, if we could, we would spend it on blacktop, because that's our highest priority in our county. But we can't spend it on blacktop, and we don't know what to do with it. So for right now, we're just holding on to it, and we'll figure it out. So blacktop meaning paving the roads, right? They literally were our number one priority is we want to pave our roads. We're always looking for money for that. We know we can't use this money for that, but we don't really know what else we're supposed to do. In Mississippi, so I'm sure Alan goes into this in his written reporting, but the requirement with these funds is that 85% of the funds have to be spent on opioid remediation. Of that, 70% of all the funds have to be future opioid remediation, so investing in new programs, et cetera. That other 15 can be reimbursements to the state, so whether that's legal reimbursements or other things. And then that extra 15%, they basically are 15% of all the funds that come into your state don't have to be spent on opioid remediation. You can kind of do what you want with it. And that was to give them a little bit of wiggle room. But most people have come to agree that the intention of these funds were earned is the wrong word. These funds come to us as blood money. That's a term a lot of people have used, right? People have died at the hands of pharmaceutical companies, among other things, but the pharmaceutical companies playing a really big role in how they were really preying on our communities. And all of these monies, every dollar of these should be used for opioid remediation. That is the intention of the money. So when AG Fitch went out there, and she was just giving the straight and legal definition of okay, our plan is to give 70% of the dollars for this future new fancy program, right? The other 15, the state is going to handle, and we'll do whatever opioid remediation stuff we want to do with it at the state level. That leaves this extra 15% for you all to do whatever you want with it. So technically that's true. But again, the spirit of the opioid settlements is to really address the opioid overdose crisis. And it's really nice to hear that some county administrators really understand that, but are just acknowledging that they don't have the skills to, or the knowledge to like do that correctly. So what a lot of other states have done, it has looked different in different states from what I've seen, but there's usually some entity that has come in to provide that guidance to local leaders, like understanding that those local leaders don't have that expertise. So in Tennessee, for example, it's the University of Tennessee. They have a department, whatever. They have like an agency within that was already doing a lot of this work with local governments around substance use issues, and so it made a lot of sense. I think that they wrote a proposal to the local, to the Tennessee Opioid Abatement Commission, saying like, hey, like if you can give us a small chunk of those opioid settlement funds, we can expand our work to include guidance around opioid settlement spending. In North Carolina, it was the County Commissioners Association, because again, most of the funds are going directly to counties. Like we're a group that's already working with county leaders. We've built trust with them, so we can provide this guidance. And they've gone, as Alan mentioned, they've gone really in depth by creating like really in-depth FAQs, creating a few more like extra rules to really encourage folks to spend it correctly. Virginia is another great example where they have an opioid abatement authority, is what they call themselves. And again, that authority, they don't have control over the portion of funds that goes directly to counties, but they do have control over this other pot of money that counties can tap into. And so they set up an incentive structure to say, if you want money out of our pot, then you have to tell us how you're spending your direct funds. So you have to report that to us. And B, if you are spending your direct funds to our gold standard, which is for this like future opioid remediation things, then we actually have this other pot of money that you can tap into, like an additional pot of money. So there's a literal financial incentive. So, and those are just a few examples. A lot of states have put together things like this, or they have contracted out to some consulting agency that has done a lot of work around behavioral health and opioid overdose issues to come in and provide guidance to their local leaders. There are plenty of ways to do it. The word I think I used before in talking with Alan was like, when I was looking at the Mississippi plan, I was like, I mean, it's very simple and it's kind of lazy. Like, I think that when people ask me what is important to me around opioid settlements, like what message I want to be giving, it's like, I want states and localities to be intentional. I want them to think about where these dollars came from and what not just the legal intention, but what the spirit, what the intention of this money is, and like be creative, but be intentional in how you are investing these funds to help create change, positive change around the opioid overdose crisis.
So, Tricia, it sounds like kind of what you're saying. You've seen a lot of states that seem to have put a lot of thought, a lot of intention, a lot of detail into, a pretty intense process and a pretty smart process, it sounds like, to include incentives. Mississippi basically took the foundational blueprint that was made as a place, sort of a starting point, and just adopted it, is what it sounds like.
Absolutely. That's exactly what they did. Yep.
And we should acknowledge, too, that 15% of this money is going directly to the local governments right now. The remaining 85% is, so Tricia referenced the plan to send this money initially to the University of Mississippi Medical Center. That's no longer the plan. The state legislature changed the plan earlier this year. So now there is an advisory council that's going to take applications for future opioid abatement projects and review them. I believe the application is due later this week, actually, and they're going to make decisions. The advisory council is going to review them. We don't know what that process is going to look like. It's been chaotic up to this point at the meetings that I've attended. You could read about that on our website if you're interested. But the goal is to get recommendations to the legislature by December. And the key word there is recommendations. Those decisions are not binding from the advisory council. James Moore is actually, the man we reference, is on that council as well, among many dozens of other people.
40-something people total, right?
I think so, in terms of both voting and non-voting. It's a lot of people. So I think that the number of voting members is smaller than the number of non-voting members. So, and James Moore is one of the voting members. But, you have prominent people like Chief Justice Randolph. who are Chief Justice Michael Randolph, who are on this council as well. But that money, the legislature gets to, reject or accept any of the recommendations. And the committee, I believe, has to present every recommendation, or at least acknowledge every grant application to the legislature. And the legislature will make its decisions. But my understanding is that's going through the regular budgeting process. And that means that it'll be incorporated into the fiscal year budget that is released in July of every year. So at this point in time, those 85% of monies, they're locked up aside from lawyers' fees and administrative fees. And they're going to be locked up until at least July 1st, 2026. So for now, this is all we've got.
The local funds are all we've got. That's right. And back to that black box sentiment. Talk about what's happened when you've tried to reach out multiple times to Lieutenant Governor Hosemann, Speaker Jason White, about what are their plans? Here we are in September. The legislative session starts in January. What are they thinking for this big pot of money, most of which is supposed to go to opioid remediation?
So I've only been here for 5 months, but I've sent Lieutenant Governor Hosemann and Speaker White a number of emails related to this, and they've never responded. So I don't know what they're thinking. I wish I knew their priorities. I think that I'm really interested in learning their priorities, and I think their public sentiments have said that they are interested in addressing this. After we reported a story that of what was happening in Hattiesburg, and one featuring James Moore, Speaker White chose James Moore to be his nomination for the advisory council that's helping to make these decisions now. So that indicates to me, I think Lieutenant Governor Hosemann sent out a press release after he made his nominations saying that, he is really committed to addressing this crisis. So I want to learn more about that, but I haven't actually got to talk to them.
And in fact, really the only substantive ideas we've heard of from a legislator, I believe, have come from House Public Health Chairman Sam Creekmore.
Yeah.
Can you talk about that?
Yeah, I guess one kind of slight amendment to that. The person who led the bill this year, Senator Nicole Boyd, she's also talked to me a little bit about some of her priorities. I think she has, everything she said to me has said she wants this money to address the public health crisis that, we've all been, and some communities more than others have been dealing with for decades now. I think so. Yes, Representative Sam Creekmore has sat down and met with me and, talked a little bit about what he's been interested in actually addressing the overdose crisis. He has been interested in using some of this money to help fund clinical trials of a drug called Ibogaine. And it is a psychedelic drug that has some preliminary evidence that it might be able to help address opioid use disorder. But a lot of reviews of those studies have said there's a lot of risk of bias in these. It's not legal in the U.S. to use clinically. It's a Schedule I drug. I've heard stories of people going to Mexico to receive this treatment. My understanding is that a few states are interested in funding clinical trials related to studying this drug. And I don't know if any, and Tricia might know better than me on this, but I don't think any have actually used opioid settlement dollars to fund these clinical trials. But that is what Creekmore is suggesting right now.
Correct. Yeah. The state of Texas recently is setting aside some money for clinical trials, but it's not opioid settlement money. And the Kentucky, they were the ones who originally had a proposal to set aside opioid settlement money. And there was a lot of pushback. And I think even from advocates who maybe believed in the potential of ibogaine for OUD treatment. They just were like, they were asking, I think, for $45 million of opioid settlement money to be set aside for this. I'm like, that's a lot of money that could be invested in things that we know work. Like that we know we don't have enough access to methadone and buprenorphine, which are the gold standard medication treatments for opioid use disorder. Like, why don't we use the money that we have to invest in what we know works and building up that infrastructure rather than this, kind of gambling it away. And I say that as someone like, I believe in the potential of ibogaine as well, but I kind of feel that way of like this opioid settlement money should be spent on things that we know work right now that we don't have enough access to in our communities. In Mississippi in particular, like Mississippi doesn't have access to a lot of those treatments. And so that's a big consideration for lawmakers. And quickly, Alan, the other thing I wanted to mention is there's I don't know if you talk about this in your articles. Mm-hmm. Another rule or guideline around opioid settlement spending is that those dollars cannot be used for supplantation. That means they can't be used to offset the cost, right? Like government funds were being used for XYZ. We're going to use opioid settlement funds for that instead so that we can free up that other budget, for blacktop or for whatever. Mm-hmm. So that is a rule that's, again, written into those settlement agreements. Mm-hmm. That's always been a concern. It is particularly a concern coming into the next legislature. This is, again, all over the country. Advocates are talking about this because of all of the federal funding cuts that have been coming down this year. There's been a lot of cuts to our healthcare infrastructure. And so some states are looking into tapping into the opioid settlement money to make up for that. And it becomes a really complicated discussion because I think that there are some instances where that is appropriate, where this really important program that serves people with substance use disorder, is, possibly could shut down because of these federal funding cuts, then maybe that's an acceptable use of opioid settlement funds. But in New Jersey, the legislature recently pulled money away from the opioid settlement fund to give to a couple of hospital systems without any real explanation of how that money will be used for substance use disorder. And advocates are enraged. There's been so much pushback. They're really working to claw that money back.
Right? There have been people sitting in government.
Yeah, they conducted a die-in in the legislature. And I know some of the advocates personally. They have been knocking on everybody's door. They're not going to let this go because they're like, we have been thinking about this money for years. We've been putting together a strategic plan, and now you're just going to come up from behind and take the money away from us? Absolutely not. But again, those are legislatures all over the country are going to be having those conversations. And in a state like Mississippi, where there isn't already a really good plan, I would be particularly worried that the legislatures are going to say oh, well, we have this hole in our budget, so this is how we can fill it. So that's something for your listeners to think through, how to prevent some of that.
Yeah, thank you for really highlighting that. And one thing to clarify, and correct me if I'm wrong, but the supplantation rules, they only apply to the 70% future opioid abatement, right? That is, I don't think it applies to the money that is in the local governments in Mississippi right now.
I think you're correct. Yeah. Again, legally, but if we're thinking about the spirit of these funds, the spirit is no supplantation with any of that money. Thinking of that Virginia incentive, when they talk about their gold standard policy, they specifically lay out no supplantation as well, even for those local funds.
Gotcha. I want to dive in a little bit into the spending that's actually been happening in the local governments right now. So let's start first with the addiction. The money that is the $945,000 that is being used to respond to the public health crisis. So about 80% of that money is going directly to drug courts or crisis intervention services. Drug courts, for those who don't know, they're programs that people who are arrested based off of, nonviolent drug charges, I believe, have an opportunity to have, in some cases, their records expunged if they agree to enter substance use disorder treatment. And so a lot of drug courts operate throughout Mississippi, and a lot of local governments have seen them that are using their monies to address addiction. They have allocated some portion, or in some cases all of their portions, to the local drug courts. And then you have crisis intervention services. So crisis intervention units are run by the community mental health centers in Mississippi. which operate in every county in Mississippi. They are often used as these stabilization units where, they're called crisis stabilization units. They are used when someone is experiencing an acute mental health emergency to be a safe place for them to stabilize and, in some cases, return to their communities soon afterwards. They don't directly address treatment in the same way a residential or outpatient treatment program would, according to the Department of Mental Health, according to Melody Medeiros, who we quote in our story, and I talked to just better understand what this program does. And they stabilize, but they don't have the same type of resources that an addiction treatment program would. But they've been in the news lately. We've done a fair bit of reporting about them at Mississippi Today. Isabel Taft, one of the former reporters, did extensive reporting about them. There's these reports that come out from one of the state offices about the accessibility of mental health, community mental health. And one of the reports flagged that people, if they have a substance use disorder or alcohol use disorder, they're often referred to residential treatment programs instead. So,
as in the CSUs are not really the place for those people.
Yes.
Yeah.
Yes. And, talking to Melody Medeiros, she said, if local governments do want to really combat the crisis, then funding the community mental health centers' addiction treatment programs might be a better way to actually do that. And, Tricia talked about how some of these resources aren't super accessible, some of the overdose prevention resources. One of the studies that I cite a lot in this series is a Journal of American Medical Association study from 2023 that among Medicaid recipients, the federal state program, health insurance program for vulnerable Americans, I believe only less than 30% of Mississippians diagnosed with an opioid use disorder received medication for that disorder. So most of the most vulnerable Mississippians with opioid addiction are not getting the gold standard treatment that Tricia referenced earlier. So, there are these gaps. We look at the study done of the recovery residences in Mississippi. Mississippi has one of the most porous infrastructure of residential recovery residences. And, these are resources that a lot of, evidence has shown that these are essential to the continuum. It's extremely common to relapse when you're going through addiction treatment. One of the best ways to prevent that is to create a stable long-term plan to help you in your recovery. And that is just not accessible when it comes to Mississippi.
Yeah, and I know as part of the settlement agreements, there's this document called Exhibit E, which I'm sure Alan has referenced. It's a 15-page document, and it's not comprehensive. It's not like a list that folks have to stick to when spending their funds. But the idea was to give some of this broader guidance of here are some really evidence-based ways to spend your money. Page 1, the first 2 items that are listed there is naloxone, so the drug that can reverse opioid overdoses, so increasing access to and training people in naloxone. And number 2 is medication-assisted treatment, or medications for opioid use disorder is the other term. So increasing access to medications for opioid use disorder. So if you don't know where to start there. Look into, and again, not being from Mississippi, but my understanding is that access to naloxone is not super easy for most people. So that should be the number one thing that jurisdictions think about is how can we maybe purchase naloxone with our funds? And what can we do to get naloxone out into the communities? So a lot of places have invested in vending machines in community areas, or hiring on new peer recovery specialists who are doing naloxone training in communities. There's a lot of different interventions like that, like with the goal of increasing naloxone access to people who use drugs, people who are at risk of opioid overdose. With medications and with treatment, it can be a little more expensive and a little more complicated because there's all like the DEA regulations involved in that. But again, that some of that infrastructure already exists. So people know what the gaps are and they know, where it needs to be shored up. So talk with your local treatment providers about how to shore up those programs or expand them into rural areas or, wherever folks don't already have access. Transportation has been another big one, right? So for folks, a lot of folks don't have access to transportation, a lot of the vulnerable folks you're talking about. So maybe it's an investment into transportation so that they can access treatment services.
That was one of the spending items that I saw too. I believe it was in Harrison County. Some of the money was being spent for transport for Ubers, I believe, to transport people to the local drug treatment court. So some of that, transportation is an issue that my understanding is that it's on legislators' radar, not necessarily in the context of addressing addiction, but in a primarily rural state like Mississippi, people know that there are transportation gaps. And I think that's what I understand you saying is it's important to remember that these transportation gaps apply to this crisis as well.
Absolutely.
And we've reported on a recent change in the law that allows bulk distribution of naloxone that has basically enabled a program at the Department of Health to really, really increase the amount of free naloxone being distributed to organizations around the state. So that's sort of another example of one of these existing infrastructure pieces that could be expanded on.
Absolutely.
So Tricia was among one of the many people I showed this information to help give better context. I showed it to Mississippians, deeply familiar with this crisis, usually, unfortunately, by personal tragedy, family tragedy, and then a number of people I have worked with who I think have a very comprehensive understanding of the overdose crisis. So there was a Mississippi peer support specialist, Melody Worsham, who, when I told her about all this information, and specifically looking at the general expenses, how much money this $4.3 million that was being spent just for general expenses, she said she offered to fill the potholes herself in all these local governments if they would stop using this money for these general expenses. Jane Claire Tyner, whose son died while struggling with addiction, she's a Pine Belt resident. She said she had no interest in getting a settlement check herself, as would maybe work in other class action lawsuits. But her heart aches knowing that so little of the money has yet to be used to address addiction. Dr. Judith Feinberg, a West Virginia University psychiatrist, who's co-authored these state guidelines for how they can effectively spend the settlement dollars to address the public health crisis. She gave me a quote that says, "From a public health perspective, this is complete and utter bullshit." She went on to say that it seemed like a pretty political decision from Attorney General Fitch to, the decision that you categorize as simple and somewhat lazy to just not really think about how to create an incentive structure for every amount of the dollars to really be going to addressing the public health crisis. Dr. Rahul Gupta, the former Office of National Drug Control Policy Director, also known as the National Drug Czar, the top drug prevention official in the country, he served during the Biden administration, said it was disheartening to see these results. And he said that the responsibility lies with the state, really. It lies with the people who are managing these opioid settlement monies to provide guidance for the towns, cities, and counties on how these dollars can be spent responsibly. Dr. Caleb Alexander, a Johns Hopkins University School of Public Health professor, who he served as an expert witness for when the plaintiff lawyers were arguing for a lot of these settlement monies and saying that this money was really crucial to addressing the public health crisis. He said that spending just so little of this money 3 years into the process it's a problem. And so I presented a lot of these findings to Attorney General Fitch. I sent her a letter, outlining the information that we've talked about earlier today and asking her if she still stood by the decision to allow the towns, cities, and counties to spend their money on non-abatement, asking her if she would consider, the examples of states like North Carolina that have created these comprehensive guidances to author some of her own that could help local governments understand how this money could be going as far as it can. Asking her whether she and the legislature had done enough with these tens of millions of dollars they've received to address this crisis that, at the lowest estimate that I came up with, like looking at CDC, Centers for Disease Control and Prevention, and Mississippi State Department of Health data, has killed and claimed the lives of at least 1,300 Mississippians since Mississippi received its first check. She didn't respond to any of the specific questions, but her chief of staff, Michelle Williams, did give me a statement. She basically said that the settlements allowed for what Tricia talked about for this past opioid remediation, and basically saying that the crisis cost hundreds of billions of dollars across the country, and that cost was borne by the governments. And the settlements took that into consideration by saying that what Tricia was saying, past opioid remediation is an acceptable use for some of these dollars. She said her office is excited that the legislature passed a bill to start distributing these dollars, and the Attorney General's office is committed to doing everything they can to make sure this money goes out where it's needed quickly. Yeah, but she wouldn't directly answer whether this money is how she feels about, the process, the opioid settlement distribution so far.
Well, one thing I can share, Ellen, is, again, if we're looking at sort of the letter of the law, like the agreements in their legal speak, I'm not a lawyer, but my understanding is that the Attorney General is not legally responsible for these funds. I think there is there's certainly some pushback. If the funds are gravely misspent, then the AG might, the state would get in some trouble. There's the potential that the funds could be clawed back, but the actual mechanics of that is sort of unclear how that would happen. But I will say that there has been public pressure in several states to the AG, or if there is this opioid abatement council of some sort that's been created, to provide that kind of guidance and to be tracking spending to make sure that at least that 85%, but again, ideally 100% of the funds are being spent on opioid remediation. So the first example that comes to my mind is up in Maine. It was kind of similar, where their local spending was either not being spent at all, or when the examples that people were finding, it was pretty poor spending. And so there was some public outcry, and it was the AG who decided to fund a group out of a local university, to create a new entity to do this kind of provision of guidance. So they're working with local government leaders to help them understand the funds, how they can be spent. They're, when possible, they're helping them to conduct needs assessments or connecting them with folks to create new services. And so sometimes it is the AG that steps in and can make those decisions. In Mississippi, maybe it's the AG, maybe it's the legislature, now that they have control over a big pot of funding. But there are people who have control and power over these funds who can make those decisions to create an incentive structure and or provide guidance so that our local electeds understand how best to spend their money.
So I guess if I hear what you're saying, it's at least with Mississippi, this month marks 3 years since at least the state has received its first settlement check. Where we're at right now doesn't look great. It's not too late for Mississippi to spend its opioid settlement money responsibly.
Absolutely, it's not too late. And localities are going to be continuing to receive checks for, more than 10 years. So they're going to keep getting money. And our electeds are going to change over time too, right? So there's also some pressure of like, you have to create an infrastructure so that as new electeds come into office, they understand the funding and their responsibility over the funding. But no, it's definitely not too late, especially in a state like Mississippi where not a lot of money has been spent. Very little of the money that has been allocated to localities has even been spent. Much of it is just sitting.
40%. Yeah, just over 40% has been spent. And, another close to 60% is, from my understanding, unspent right now.
So yeah, there's definitely still time to spend it with more thoughtfulness, both those state funds and those local funds.
Well, this has been really insightful and just a wealth of information, and been very interesting to hear, how Mississippi sits in comparison to surrounding states. So thank you so much, Tricia, and thank you so much, Alan, for your work and for your insights here.
Thank you so much for having me.
Thank you so much, Kate.